Herceptin, also known as Trastuzumab, a vital drug in the treatment of HER2-positive cancers. Herceptin is a monoclonal antibody that targets the human epidermal growth factor receptor 2. This receptor is overexpressed in some breast and gastric cancers. By specifically targeting this receptor, Herceptin helps stop the growth of cancer cells that depend on HER2 signaling. Herceptin is used to treat HER2-positive breast cancer, including early-stage disease and metastatic breast cancer, HER2-positive metastatic gastric or gastroesophageal junction adenocarcinoma. In breast cancer, it is used either in combination with chemotherapy or as monotherapy. In gastric cancer, it is combined with cisplatin and a fluoropyrimidine. Trastuzumab binds to the extracellular domain of the HER2 receptor. This binding inhibits the growth of HER2 overexpressing cells, prevents HER2 receptor dimerization and downstream signaling, and triggers antibody-dependent cellular cytotoxicity, a process where immune cells destroy cancer cells. The dosage depends on the indication and the method of administration, either intravenous or subcutaneous. For intravenous administration, the loading dose is 8 mg per kilogram, given over 90 minutes for metastatic breast cancer, or 4 mg per kilogram for early breast cancer. The maintenance dose is 6 mg per kilogram every 3 weeks, administered over 30 to 90 minutes. For subcutaneous administration, a fixed dose of 600 mg is injected every 3 weeks over 2 to 5 minutes. For early breast cancer, therapy is usually continued for 1 year. For metastatic cancer, treatment continues until disease progression. Common side effects include fever and chills, nausea and vomiting, headache, diarrhea, fatigue, and infusion-related reactions. Serious side effects include cardiotoxicity, such as reduced ejection fraction or heart failure, pulmonary toxicity, including interstitial pneumonitis and acute respiratory distress syndrome, severe allergic reactions, and embryo-fetal toxicity. Trastuzumab increases the risk of cardiotoxicity when used with anthracyclines, such as doxorubicin. Avoid concurrent use. Caution is also advised when used with cyclophosphamide and fluorouracil, as these combinations may elevate toxicity. There are no significant CYP450 interactions. There are several warnings and precautions to consider. Left ventricular ejection fraction should be checked before starting, monitored every 3 months during treatment, and for 6 months after discontinuation. Herceptin may cause fetal harm. Effective contraception is required during treatment and for 7 months after the last dose. Patients should be closely observed during infusions. Pre-medication may be required in those with previous reactions. Treatment should be stopped if the patient develops severe respiratory symptoms. And that's all for this video. If you find this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.